This month of Valentine's is also appropriately Heart Month to raise awareness and encourage folks to take good care of their hearts. Did you know the winter cold can actually increase risk for certain types of heart attacks? Here to share what we need to know to stay heart healthy is Dr. Pfahl from Mount Carmel Health System. Thank you for being here, Doctor.
Thanks so much for having me. I appreciate it.
Okay, so set the record straight for us. Is it true that the cold winter months and these cold temperatures can actually raise our risk of having a heart attack?
Absolutely. So there's good research out there that shows cold temperatures can increase constriction of your blood vessels, that can raise your blood vessel or your blood pressure high, that can put extra strain on the heart muscle. And then when we go out in the cold weather and have to shovel the snow, that can be a lot of taxing toll on our heart and our blood vessels, and that with the high blood pressure and the cold temperatures can increase risk for having heart attacks in the winter months.
It's kind of like a ticking time bomb, I guess, when you put all that together.
Especially if you're a patient who's sedentary and doesn't get out and exercise much. That can be a lot of exercise when you're out there shoveling the snow real acutely like that.
Can be a recipe for disaster if we're not careful. Okay, so we need to know the signs then, Dr. Pfahl. What are the signs we should be looking for that we may be experiencing a heart attack?
Sure. So there's lots of good signs. So chest pain is the big one. So anybody who has left-sided chest pain, central chest pain, shortness of breath that comes on acutely or rapidly. Some people can develop pain down the left arm, pain down both arms, numbness in the hands, pain radiating to the neck and jaw. Those are probably the more typical symptoms. Some people will have sweats and feel nauseated as well.
Oh, okay. Those are ones you don't typically hear about.
Yes.
But they can play into it.
They can also play a role, yes.
You say knowing symptoms can save lives. So this is important. Once we know the symptoms, we know what to look for, and then we need to act on it, don't we?
Absolutely.
What is our first step if we are doing something outside in the cold and we start to notice, oh, here's a symptom, maybe this is another symptom? What do we do?
Yeah, so if you're not feeling right and you're out there in the cold shoveling snow and developing chest pain, shortness of breath, the first thing you need to do is stop and call 911 and get some assistance.
Okay, that is what about just sitting and resting? Is that a safe play, or is that something we should do?
You know, if you sit and rest and the pain goes away and then you start exerting yourself again, the pain comes back or symptoms come back, definitely need to seek medical involvement immediately.
Okay, that's a red flag.
Yes.
We need to be aware of something that is known as silent heart attacks. I have not heard of that before. What is a silent heart attack?
So silent heart attacks would be a heart attack that occurs without the common chest pain symptoms we think that happen with heart attacks. So without the chest pain, without the shortness of breath. Some people can have a silent heart attack if they have just nausea and then have a heart attack with the nausea, or vomiting, having the heart attack with the vomiting. So it's still a heart attack in sense, but it's not having those classic symptoms that we see that we expect to see with coronary artery disease and heart attacks.
Well, that is very serious, because how are we going to know it's coming?
Sure. I think the big thing is if something feels off, if something's different, if you're not used to having these symptoms and you're developing something new, it's worth getting checked out and evaluated by a healthcare professional. Okay,
and I've heard this before. Is it true women can have different heart attack symptoms than men? And if so, how are they different?
Absolutely. So women and patients with diabetes can have the non-typical symptoms associated with heart attacks. So abdominal pain, nausea, maybe not that elephant on the chest crushing chest pain that we expect with a heart attack.
Okay, just a personal question here. My mother-in-law recently went through some heart problems. She had jaw pain. Can jaw pain?
Absolutely. Yeah, so jaw pain is a big symptom we see, especially if you're having other symptoms with it, like shortness of breath with the jaw pain, or pain radiating down the shoulders with the jaw pain. So very common symptom we see with heart attacks, yes.
Good to know. What can we do, Dr. Pfahl, to take care of our heart during these winter months and all year long?
So the same thing all year long, right? So we want to live heart healthy lifestyle. We want to exercise, get our aerobic exercise and steps in, maintain a healthy weight. If you have problems of diabetes, cholesterol, high blood pressure, make sure you're following with a provider regularly to make sure your risk factors are in check. If you're a smoker, definitely have to get off the cigarettes.
Okay. If someone's concerned about their heart health, maybe they have been thinking, look, I can tell maybe I'm not on the right path heart-wise. What can they do right now?
Well, we have very good experts at Mount Carmel Hospital, so spread across the city. We're always more than willing to help take care of patients, and especially patients who have not had heart problems and they're wanting to balance their risk and figure out what can I do to prevent problems. Maybe, let's say you're a patient with a family member with heart problems, you want to get checked out. Definitely check out our website and schedule with a provider. We'd be happy to see you and take care of you.
Very good. And friends, we have the website on the screen now. Valuable information there. Dr. Pfahl, thank you for all this heart healthy advice.
Thanks so much for having me on. I appreciate it.